Welcome. My name is Hilda, and I'm a librarian here in the Office of Civics and Community Services at the Los Angeles Public Library. Today, we have frontline doulas with us with a panel to discuss the new Medi-Cal doula benefit. Doulas offers community-based programs that provide non-medical professional perinatal support services. Their programs have centered on advancing health equity by providing physical, emotional, informational, psychosocial, and advocacy support to Black and African American families during the pregnancy, childbirth, and postpartum period. And now I will hand it over to Tina.
Hello, everyone, and welcome to the Los Angeles Public Library in collaboration with Frontline Doulas event in honor of Black Maternal Health Week, the new Medi-Cal doula benefit, Justice in Action for LA County Families. My name is Deanna Carpenter, and I am the program manager for Frontline Doulas. Frontline Doulas is a perinatal health program that has connected over 1,000 and counting Black families with Black doulas through our various programs in Los Angeles County, California, and the United States. Our programs include our Frontline Doula Hotline and the California Black Doula Directory, to name a few. And to quote our co-founder saying, we are inspired to do all of this because we believe that the revolution is in the womb. We endeavor to embody that legacy. Black Maternal Health Week was founded by Black Mamas Matter Alliance, a Black woman-led cross-sectoral alliance that centers Black mamas and birthing people to advocate, drive research, build power, and shift culture for Black maternal health, rights, and justice. We are so excited for our Black Maternal Health Week offering, as it is an intentional time dedicated to bringing awareness, attention, education, advocacy, and action towards creating policies, research, and initiatives and programming that champions Black maternal health and hopefully reverses the discouraging trends and statistics that dramatically impact Black women and birthing people. We welcome you to our webinar, The New Medi-Cal Doula Benefit, Justice in Action for LA County Families. And so it is my joy to be able to introduce to you our panel and our featured guest doulas. So to start, I would like to introduce Kefri Riley, CLEC, CPYT, and HCHD. Kefri is the co-founder and director of Frontline Doulas, a perinatal health program connecting Black doulas to Black families, recently featured on PBS, BET, and CBS. She is also director of Impact and Development of the Los Angeles County Medi-Cal Doula Hub. Kefri served as member of the co-design advisory team for the California DHCS Medi-Cal Doula Benefit Stakeholder Work Group, and now serves on DHCS's Doula Care Work Group, California's Doula Learning and Action Collaborative, and California's Doula Labor Table Project. Her foray into the world of babies has its inspiration from her paternal great-grandmother, an African indigenous grandmother midwife from the Deep South. She brings over 20 years experience as a maternal child advocate, prenatal yoga expert, certified lactation education counselor, birth and postpartum doula, doula trainer, newborn care and childbirth educator, and hypnobabies hypnodoula. Kefri has attended over 300 births at all major hospitals throughout Los Angeles County and has taught thousands of pregnant families the joys of intuitive physiological birth and postpartum practices. Let's welcome Kefri Riley. Next, we have Chantel Reynolds, a certified doula through DONA, who has served as a doula for women and their families since 2008. Her practice is centered on curating experiences for each family based on advocacy, education, and preparation for parenthood. She has received training from Postpartum Support International in maternal and perinatal mental health, Bringing Home Baby from the Gottman Institute, California Work and Family and Paid Family Leave, and Implicit Bias and Cultural Competency. Passionate about accessibility and advocacy in maternal health, Chantel partners with local organizations to provide integrative trainings, mentoring, and affordable doula services in her community. In her free time, you can find her exploring with her kids, her 4 kids, coffee crawling with her husband, traveling throughout the world, or cycling around her city. Let's welcome Chantel Reynolds. And next, we have Felicia Francis Edwards. Felicia has worked in the Los Angeles area for more than 30 years and has served in several capacities, including case manager, social work assistant, health education assistant, and clinic manager. She completed her doula training with Doulas of North America, or DONA, and immediately began to take on clients. Felicia works with 2 agencies that provide doula support for Black birthing people in Los Angeles, Frontline Doulas, as well as the Los Angeles Public Health AIM, or African American Infant and Maternal Mortality Pilot. Each of these agencies provide free doula services to all Black birthing people. As a doula, Felicia has attended over 150 births. She feels that it is a sacred honor to serve pregnant people. She sees working as a doula as a calling that allows her to support the families she serves. To educate, encourage, and affirm is at the heart of her practice. She's grateful because she gets to do what she loves. Welcome, Felicia Francis Edwards.
And we have the wonderful Deanna Lynette Carpenter, who is a healing artist and creator of She Who Builds, a platform and community that supports women in confidently architecting and building a holistic life of their imagination. And she's also Frontline Doula's program manager or chief coordinator of care. She is on a mission to inspire healing, which she describes as a remembrance of and returning to one's truest self. Deanna is an author of 2 books, Lessons from the Fall and In My Solitude. And in 2018, she released her first album, Tsunami. Deanna is a certified Kundalini yoga teacher and birth doula and is currently working on 2 musical offerings, Dreams and Rise Again. Good to see you, Deanna.
Thank you, Kefri.
Wonderful. Next slide. We really want to thank you for attending this webinar and appreciate your participation. Well, we were focused today on California's Medi-Cal Doula benefit, which offers comprehensive doula care to beneficiaries enrolled in Medi-Cal's various managed care plans. This benefit is about the importance of access, for it is crucial for Los Angeles, California, and indeed all counties and states to increase access to community doulas for families who might not otherwise be able to afford such a service. Los Angeles families are encouraged to reach out to their managed care plans, their health plans through Medi-Cal to request a doula. Our vision is to see a diverse representation of doulas who are trained, enrolled as providers, and contracted with managed care plans to effectively meet the demands for Medi-Cal doulas. We specifically invite Black and Indigenous doulas, bilingual doulas, and doulas of all abilities and gender expressions to explore this new workforce opportunity. So glad you're here today. Next slide. I want to offer a mindful moment here for all those who are watching and are in our audience on the healing legacy of midwives, doulas, and community care. And in honor of Black Maternal Health Week, we have a theme, Rooted in Justice and Joy, marking 10 years of acknowledging the strength and resilience in Black-led perinatal, maternal, and reproductive health organizations. We believe at Frontline Doulas that together we can heal unlimited births. And you see the elder pictured here as a grandmother midwife. We do this in honor of the grandmothers that have come before us. And also one day we may become those same grandmothers passing on this wisdom. Next slide. Part of Frontline Doula's emphasis often is the understanding that we are continuing an ancestral legacy, something that is a lineage that is handed down from those before us. And so we'd like to take a moment to give respect to the ancestors, and in particular, the ancestor we'd like to mention today, and all days, because we just adore her, is Mother Biddy Mason. Born Bridget Biddy Mason, 1818 to 1891. She was born into slavery in 1818, and Mother Biddy became one of the first prominent citizens and landowners in Los Angeles in the 1850s and 1860s. She founded the first African Methodist Episcopal Church in Los Angeles in 1872. Mason fought for her freedom in court with a trial ruling that confirmed her freedom in 1856. So if y'all are wondering why doulas or advocates are out here in these streets fighting for birthing people, If Mother Biddy can fight for her own freedom and win, then we too are out here fighting for the rights of pregnant and birthing people in our communities. We can only do her name justice by doing the same. As a free woman, Biddy Mason settled in Los Angeles with her children, and she worked as a nurse, a midwife, and a healer. In 1866, she purchased a nearly 1-acre settlement between present-day Broadway and Spring Street, between 3rd and 4th Streets in downtown Los Angeles. Throughout the years, this phenomenal Black woman purchased more property, which led her to becoming a wealthy woman and a visionary philanthropist. And so we give thanks and praise to Biddy Mason for leading the way. Thank you, Mother Biddy. Next slide. This is a little bit about my personal ancestors and our collective new legacy. As you see here on the right, a beautiful picture of Los Angeles doulas. Of course, the doulas here, Felicia and Chantel, are also a part of this powerful legacy, where you see Los Angeles doulas, activist, and supervisor Holly Mitchell, a champion of the Los Angeles County Medi-Cal Doula Hub and the Medi-Cal Doula Benefit for Communities, here at our Doula Mingle launch party. So these are all the beautiful seeds of those great grandmother midwives. And on the left, you'll see a picture that surfaced just recently from my family archives of my grandmother, Big Mama, Essie Riley, and my great aunt Trudy, Gertrude McGee, in 1951. If you pay really close attention, you'll see they're holding their beautiful little Black midwife bags. And they're so unique because oftentimes the invisibility of these beautiful Black women caregivers squashed and silenced the powerful work they've been doing as healing agents in the Black community so long ago. And so to find these images and these pictures and to be reinvigorating the legacy throughout the United States and also throughout the world of the powerful work that these incredible women did for our communities is truly an honor. So I'd like to show their picture whenever I can, to remember that they were just your everyday hero. They were just simple women who loved their community and were given a gift to serve babies and families. And so we honor them. Thank you. Next slide. Deanna, would you like to share this slide?
Sure. I just want to make sure that you all can hear me.
Absolutely.
Okay, thank you. So the current state of maternal health in Los Angeles and how doulas help mitigate maternal health and birth disparities. So California has the highest number of births in the United States, with over 420,000 live births recorded in 2021. Of those 420,000 live births throughout the United States, in Los Angeles County alone, 96,230 of those births in 2021 were live births. So 42% of all births in LA County are on Medi-Cal.
That's a lot of births.
There's a lot of births.
A lot of babies. In California, and as a Medi-Cal beneficiary, you have the right to a few things under your Medi-Cal managed care plan. You have the right to doula care for pregnancy, birth, 12 months postpartum, that's after you have your baby. You have the right to care during abortion, stillbirth, and miscarriage from a doula. You have the right to comprehensive obstetrical care and perinatal services. You also have the right to access midwifery-based care and to birth at a freestanding birth center. So if you can't find a freestanding birth center, call your managed care plan and let them know that that's what you want, that's what you deserve, and that's your right. If you are breastfeeding or body feeding, you have the right to education, counseling, and medically related services to that care that you're giving your newborn. And you have the access to abortion services. So California really has a lot to offer as far as reproductive rights and benefits under Medi-Cal. And we hope that you share this news to the people in your community and others that may not know about what their rights are, and that you start asking and demanding for what they are so that we can create equitable care for birthing families in Los Angeles and California. Next slide. This is about the California Medi-Cal Doula benefit. Chantel, would you like to share?
It's my favorite benefit to talk about. So the California Medi-Cal Doula benefit, as of January 2023, all birthing and postpartum people now have the right to doula care. This is historical, one of a kind. And we know that this is going to change the trajectory of services. What does that mean? This full spectrum benefit is for the entire perinatal population. 9 months during pregnancy and birth support, whether abortion, miscarriage, loss, vaginal birth, C-section, and then postpartum support up to 12 months after any pregnancy outcome. And so families really get to experience full spectrum doula care. And so now we're at the place where the number of doulas needed for network adequacy goes beyond the number of births each year in California. And so we're really looking forward to doulas being available to support the families needed. Over 150,000 births a year on Medi-Cal, closer to almost 200,000, and they get to participate in this Medi-Cal doula benefit. Next slide, please.
I wanted to take back a step because we wanted to be able to ask both Felicia and Chantel this question regarding the current state of maternal health in Los Angeles and how doulas may help to mitigate maternal health and birth disparities. And while we may not be the catch-all solution to everything, we bring a lot to the table that is evidence-based. And so Chantel or Felicia, whichever one of you want to go first, but we'd love to hear from both of you is, what do you feel is one of the most powerful ways that doulas help mitigate maternal health and birth disparities?
I'd like to go. That picture that you showed with all those doulas is what the benefit is. We're getting the word out there about the support. And so you now, because this is kind of a field that you spend a lot of time solitarily providing support and services, but what we've been able to come together as a part of a group with the hub. So doulas are getting much more impact from other doulas. They're able to find backup doulas and they're able to find mentors. All these things have been a part. So I think that one of the most powerful things that has come around the mitigating maternal health is the build up of the doula community.
Beautiful, beautiful. Wow, what can I say about the current state of maternal health in Los Angeles? I think there's a lot. And to piggyback off of what Felicia said, we know that right now we have a benefit to address the maternal mortality crisis. And, we want to change the outcomes for specifically Black infants seeing their first birthday, right? So we know that when we talk about the state of maternal health period, we know that families are facing the closures of maternity wards. We know that means there's less accessibility to maternal care for lots of communities. We know that that impacts mental health and postpartum mood and anxiety, perinatal mood and anxiety disorders that show up prenatally or in the postpartum period. And to Felicia's point, we also know that this ancient practice of doula support, the advocacy for more access to midwifery care, is not the only answer, but is part of the solution. And so one of the ways that doulas help mitigate some of these disparities, let's talk about the inaccessibility of maternity care because of these closures, right? And because of poor outcomes for some pregnant folks, birthing folks in some of our hospitals. Doulas help mitigate some of these disparities, one, providing advocacy, right? And resources. Now families can be made more aware of what's available to them. We just went over some of their rights, some of their benefits, right? How to communicate with their insurance plans, how to communicate with their providers so that they feel heard and seen, and that they make the choices that are best for them, hopefully improving outcomes not only for the birthing person, but then also for their infant. And one of I'd say the third way that doulas help mitigate maternal health and birth disparities, and one of my favorite ways is during the postpartum period, right? We're able to come alongside families. We're in their homes, we're meeting them in spaces, and at times that oftentimes their medical providers are not able to. And so that looks like us being able to pay attention to those symptoms, those signs, those warning signs that prevent those near misses. We know that for families in this period of life, it's actually the near misses that we also want to reduce, right? Before they end up being a statistic. And so doulas can really help mitigate some of these outcomes and disparities in maternal health and for birth by being able to be there in those right in the nick of time moments. And that's one of the reasons why this benefit is so great.
Thank you so much, Chantel and Felicia. And it is so great. It's so great because doulas are fabulous. We can go to the other slides now, Dee. Doulas are fabulous because we are, we'll go to the one just before this one. We are connectors of care. We are bridges through your birth experience. We support and listen to the birthing person, to the postpartum person. We help with connection of the family to resources. We help navigate health systems. We help to listen and be that source of social emotional support to the birthing person when they may not feel that they're being heard. We uplift their voices and their choices. We do not make medical decisions for the family, nor are we medical providers, but what we do has immense Medi-Cal benefit. And here are some of the benefits that you can see that are evidence-based here for doulas as continuous support. And there are so many benefits, part of them, and these are from the Cochrane collaboration, in which they conducted a review of 15 randomized studies that met their research standards. And given the clear benefits and no known risks associated with support, every effort should be made to ensure that all laboring people receive continuous support. And this support should include continuous presence and the provision of hands-on comfort and encouragement. And with that, we'll go to the next slide. That basic support and that basic presence, that continuous support gives these incredible results. Chantel.
So when we talk about continuous support, here's some of the key ways where doulas are able to show up. We are there present long before families enter the hospital doors and then long afterwards. And most of us know we're there the entire time. And so with our presence, continuous support, providing education, providing resources, the physical comfort, the spirit, right? We see the reduction in cesareans. We're able to give clients tools like brain. What are the benefits, risk? What are the alternatives? Do you need more information? Or do you want to say no to this intervention or augmentation so you can make a more informed decision about your care? And because of that, doula presence and that continuous care, we see that folks are less likely to use forceps or the vacuum. Anesthesia, with continuous support, we now have science that shows that just continuous support reduces the need for epidurals, which we know 2 out of 3 birthing people choose in their labor. And so we're able to decrease that, which means less time on fluids, less risk associated with having that procedure done, and better outcomes for the onset of lactogenesis. And so continuous support is something that doulas are able to provide not only during the pregnancy period, but during the birth and postpartum. Next slide, please.
And also, next slide for sure. Also, you've got the satisfaction and feeling good about giving birth. Like, you should be like, that was amazing. I gave birth to a full-blown human. Oh my goodness.
Yes.
And so doulas help increase that that feeling of satisfaction, right? And that feeling we take with us the rest of our lives. You never forget your birth experience. And if you look into the perinatal psychology of an infant, they also remember how they're born. And it imprints onto their nervous system. And so all of this, why people say the birth is sacred or this is an ancient practice, because from the beginning of time, honey, since when babies dropped into this planet, there was somebody saying, I'll help you. I'll be there. And that's why doulas is so fantastic, is that we're continuing on this amazing offering that humanity gives one another, which is support.
Offer something, Kefri, which is interesting. I had a birth on May 7th. Talk about continuous support. We were hanging in with each other, so we spent a lot of time in educating and all. But she had some specific things that she wanted to have as part of her birth. She wanted to go to the hospital when she was 311, meaning contractions every 3 minutes for a minute for at least an hour. And she did. So she got there 311. She was 5 to 6. She was able to use hypnobirth, breathing techniques, relaxation. So she was able to have an unmedicated birth. So she got to the hospital at 10:30. By 12:08, the baby was born. So that continuous support that started prenatally and happens throughout the entire pregnancy is such a reward. And not every person gets to be able to have an unmedicated birth, but when someone can have that with the support of a doula, it makes such a big difference. It's powerful what we do.
It is so powerful. And when you think, Chantel, as you were talking about, when you think about like an epidural or anesthesia or analgesia, they don't come without risks. And so you want your provider, whether they're an OB or a midwife, to discuss the risks and the benefits so that you're understanding really what you're agreeing to. And so some of those risks could include maternal fever. You know, some of them can include more interventions. And with more interventions, or what we call the cascade of interventions, then there are different outcomes that can happen after that. And so you want to use all of these things as tools that you, as the birthing family, have the decision and the right to choose. And that's what makes the difference in if you feel satisfied or unsatisfied or negative or positive, is were you listened to? Were you respected? Were you given an opportunity to understand what your choices are? Did you feel like your position, your family had culturally congruent care and was aligned with what your family desired? Those things make a difference in how we feel about our birth. And I believe that doulas create a bridge to amplifying what the families themselves are wanting. It's really about family-centered care and human rights at birth. And that's why we get these outcomes. And it's so interesting because people often feel like we're, you know, blowing bubbles at birth or just spraying flower spray all over the place. And we do that if you want it. But really, it's the social emotional support that is evidenced to have such profound impact on the birthing families. Yeah, it's super cool. And we hope you all choose a doula and call your managed care plan to get a doula. We'll go to the next slide. The Medi-Cal Doula benefit went live as of January 1st, 2023. And if you're interested, you can always scan this QR code to find out more from the Department of Healthcare Services. It will take you to that website. Doula services encompass health education, advocacy, physical, emotional, and non-medical support provided before, during, and after childbirth and or the end of a pregnancy, including the postpartum period. Full spectrum doula care is prenatal and postpartum doula care, which includes the presence during labor and delivery and doula support for miscarriage, stillbirth, and abortion. Doula care also includes physical, emotional, and other non-medical care. Postpartum period is also covered up to 1 year or 12 months from the end of a pregnancy. Beneficiaries who are covered under Medi-Cal are eligible to receive full scope Medi-Cal coverage for at least 12 months after a pregnancy. And that is why this benefit is so amazing, that it covers you in your whole gestational time, during your birthing time, and in the year after the baby is born or the pregnancy has ended. Next slide. Chantel, maybe do you want to go into all the
Yes. Oh, also one of my favorite parts. This benefit is amazing because to follow up with our previous, segment on continuous support, we're really providing family services through the first 9 months, and all the way through the 12-month postpartum. So what does that look like? One initial visit where you're doing your intake with your doula. If you're a doula, that's the time where you're getting into all the ins and outs of doula support. Up to 8 additional visits that can be used either as prenatal or postpartum visits. So as it works for the family and or the doula. Then you have support during labor and birth. And that labor and birth could be, as a result of stillbirth, abortion, miscarriage, or if it's a live birth, if it's a C-section, a VBAC, or vaginal birth. However, the pregnant person needs support, you get doula support during the labor and delivery process. Then immediately after, you have the availability to have 2 extended 3 postpartum visits that can be used however the family needs and however the doula offers that support. And so the extended 3-hour postpartum visits can be provided and don't need additional recommendation or permission from insurance plans for a doula to be able to provide that support. And here's the great part. Up to 9 additional postpartum visits are available to members, and they can be used up to 12 months postpartum. And so when we think about the instances of perinatal mood and anxiety disorders, when we think of folks that maybe have multiples or just have a harder time transitioning, the access to 9 additional postpartum visits ensures that families have, again, some type of continuous support. At least that's how I see it. After baby's born, there's no fall off after that 1 week postpartum, that one postpartum visit at, 6 weeks or 4 weeks. Really, you're able to walk with your families at every checkup. And so this statewide standing order is in place to cover all initial services, and a recommendation is needed from a licensed practitioner for the additional 9 postpartum visits. Next slide, please.
This slide is a little bit about the new Los Angeles County Doula Hub, which is our amazing offer to the community from Frontline Doulas in partnership with Diversity Uplifts and in collaboration with the Los Angeles County Department of Public Health. The Los Angeles County Medi-Cal Doula Hub supports the rollout of the Medi-Cal Doula benefit by providing workforce development for doulas and public education to LA County residents about the positive impacts of doula care in efforts to address the current perinatal and infant health disparities. And so we would love to encourage you to go to ladoulahub.com to find out more about the various offerings in these areas that we help doulas and the families that they serve. We support workforce development, technical assistance, training and system integration, public awareness and evaluation. So there's many ways that you can engage with us. We have resources for families there. We have resources for doulas. And in general, we'd love to support you in any way we can to find out more about how you are able to experience or access the benefit. And we'll share a little bit more in the following slides. Our mission is to educate, connect, and advocate for doulas, families, and communities so that any Medi-Cal beneficiary who desires the affirming support of full-spectrum doula care will be able to receive it. We want a doula on every block. So that means your block and your neighbor's block and the block over. We want somebody who's able to serve you so you feel supported and listened to with kindness, love, and respect. A doula on every block. Next slide. Our mission is, as we said earlier, is to educate, connect, and advocate so that we can experience healthier perinatal outcomes and an empowered doula workforce, prioritizing families that are most at risk for these adverse birth outcomes. And that means bringing birth justice to families that are living in the culturally diverse neighborhoods of LA County. And we do that by uplifting the voices of the doulas and of the families. So we educate by creating opportunities for sharing information with doulas and families, like this webinar about the Medi-Cal doula benefit. We also include supporting doulas in navigating this emerging professional workforce opportunity. There's so much to learn. There's so much newness, and it's really a historical benefit. There's never been one before, ever. And so both healthcare systems and the doulas themselves are learning how to work together and to collaborate to learn how we can give the best care to LA County. We connect communities, families, caregivers, and providers to create healthy perinatal ecosystems. So we want you to know how to connect to your managed care plan. We want you to know how to advocate for yourself inside of a hospital system. We want you to understand your rights to lactation care and any other resources that will help your family with the emerging needs that you might experience in your perinatal journey. And we want to support doulas in learning how to do so. And by doing that, or efforts to do that, we advocate for the doulas and birthing families like you to improve birth outcomes in LA County. So we always want to hear about you and any experiences you're having in hospitals or clinics, et cetera, whether they're good or bad. And so that way we can really reflect back to our collaborators and those systems needs for improvement and change. Next slide. So join us in the mission to heal unlimited birth at ladoulahub.com. And you can even watch all of our different posts and find out about our events and our resources on our Instagram and Facebook channels, which are at Frontline Doulas or frontlinedoulas.com. Now, here's some resources, and I'll leave it to Chantel to take you through some of these slides.
Thanks, Kefri. All right, so how to get doula support step by step. As a reminder, all pregnant and postpartum Medi-Cal members are eligible. So families can come, even if they are just hearing about this benefit, they're postpartum, and it hasn't been 12 months since their birth, they're still eligible for doula support. You don't need a referral or approval from your Medi-Cal provider to work with a doula. So whatever your managed care plan is or your insurance company, the member can contact member services and say, hey, I need a doula. how do I connect with a doula that's with my managed care plan? Dual services are available at no cost through your insurance. Okay. Doulas offer support during pregnancy, birth, and after the baby is born. Okay. Support is also available for miscarriages, stillbirths, and abortions. And this is a critical one that I think more families need to be aware of, and more individuals as they are navigating their reproductive journey. And lastly, additional language services are available through managed care plans and at DHCS. And so if there are any barriers, whether it's language, accessibility, the need for an interpreter of any kind, or enhanced care management, all of these services are available to you and are the rights of Medi-Cal members, and their insurance company should be able to provide that for them. And so first step, to get a doula, contact member services. Again, you're eligible through pregnancy, during the birth process, and postpartum. Let's see. Next slide, please.
Yes, and Chantel, before I go to the next
Oh,
slide,
sure.
I also just wanted to encourage you that you can please bring your camera and scan on these QR codes, and it'll take you directly to this guide so that you can have it as a resource beyond this presentation. Thank you.
Perfect. So we just talked about it. Step one, call your managed care plan member services and ask for a doula contracted, right? There's no need to get overwhelmed. There is a long, lengthy list at DHCS's website, but if you call member services, the number below, if you have not been assigned to a managed care plan and you have direct Medi-Cal, you can also help members find out basically who they'll be assigned to. But on the back of the member's card, you have the number for the managed care plans member services. Contact them and ask, I need to be connected with a doula that's contracted with my health plan. Okay. Let's see. Step two, Deanna. You can contact a doula on your health plan, right? So again, using your camera on your phone, if you can scan this QR code or go to ladoulahub.com/families. Again, for all of these resources, and we're taking you step by step to contact a doula that's already contracted with your health plan.
Exactly. And the reason why, Chantel, and we can keep going, Deanna, is we know unless you request doula care, you may not be able to find a doula, right? And so the only way we're going to increase access for you is for you to reach out to your health plans, have them give you a list of the doulas, or you can go to Cali Black Doula Directory and find doulas there that are also listed that accept the various different managed care plans in Los Angeles County and throughout California. But as soon as you contact the doula through your managed care plan, reach out to them, speak to them, check in with them, see if they meet your needs, see if they feel aligned with what your family wants, see if they're a match. And if they are a match, then you would move forward to the next step. Next slide, Deanna. The next slide is to schedule your appointment.
Gotta do that. Schedule your appointment with your doula and begin receiving doula care. And so one of the recommendations I would make to those of you who are looking for doula support is to kind of think through, and we have these resources on the LA Doula Hub website of the conversations to have with your doula, okay? So think about, they're gonna wanna know where your birthday and when you're due, any special things that have come up with your pregnancy, if you have a provider, and where you're located, right? Because where you're located and where you might be birthing might be different places. But go ahead and jump in on that, because one of the things you're gonna wanna ask your doula is if they're available. Okay, while they may be contracted with your plan, as we've discussed in the beginning of this presentation, nearly 400,000 babies are born in the state of California every year, and over 180,000 families birth on Medi-Cal. And so as soon as you can, find out if you can get a doula connecting with a doula through your managed care plan.
I think it's exciting, Chantel. We're going to connect more families to doulas.
Woohoo.
Felicia, I know we always say we have families coming out of our ears.
Yes.
There's so many families that need doula care. There's so many postpartum families
Mhm.
that, this is what's really exciting is that after you have the baby, a doula can support you. They can come to your home. They can help you navigate the hospital systems or the healthcare systems. They can also share with you the various things that are your right as a postpartum person and for your family. There's so many resources that are available right now. We want you to get them. You deserve them.
Yes.
So if you go to ladoulahub.com/families, there's a lot of information there for you. We can go to the next slide. Oh, this part. This is interesting. And we wanted to help you in this instance because we know there is a high demand for approved doula providers, and families seeking doula care directly through Medi-Cal or their managed care plan may face challenges in being matched with a doula. So even if you're on straight Medi-Cal and have not yet been connected with the managed care plan, which typically happens in the first 30 days or so, but even if so, a doula can still help you. And so if you want to connect to more resources to finding a doula below, you can scan this QR code, or we'll go to the next slide. We'll talk a little bit about the various different programs that are available in Los Angeles counties. As Felicia has shared, this is with the AIM program, the African American Infant and Maternal Mortality Initiative. There's a Joy in Birthing Foundation that has volunteer doulas. In Long Beach, there's Birth Workers of Color Collective that has a large collective of doulas able to serve you. In the South Bay, there's the SBCC Thrive LA organization that has a formal doula program that you can find a doula to support you. And in Antelope Valley, there's the In Due Time Coalition. And there's many other organizations that are also here to help. Next slide. And also, you can contact and book a call with one of our amazing, beautiful doulas on the Frontline Doula Hotline. We serve LA County and all of California, including the United States. So you would go to frontlinedoulahotline.com or text the words doula help, one word, to 833-987-2908. And that will connect you into the track, basically right where you can book your call. It's really easy. You enter in your information, you choose a day and a time, and then you connect with the doula and they give you doula care. So it's free, no cost telehealth for one of our beautiful Black doulas. And we really hope to see you online sometime soon. Next slide.
Yes, and also just want to shout out that Chantel is one of our lovely hotline doulas. So you might be able to get on a call with Chantel. So book a call.
And I just wanted to piggyback off of that real quick because I can't stress enough to families. Whenever you're feeling overwhelmed, any time of day and night, text doula help to 833-987-2908 to get doula support. Whether you have Medi-Cal or not, the hotline is available to any Black birthing person in the state of California and now even beyond. So this is really important. Anytime, day or night, please book a call. You don't have to do this alone.
Yes, and to piggyback off of Chantel, this is also available to the fathers and partners of the birthing person too. So if you have questions, wanting to figure out or wanting to gain more information on how you can be support or how you can be resourced during the process as well, feel free to book a call. So thank you both.
I would like to add that Frontline really is committed to making sure there's a doula on every block with all the services that are offered. And I think it's just, we will go to the end of the earth to make sure people get the doula support they need. And one of the most powerful things is that it can be cost prohibitive to pay out of pocket for doula support. And so with the Medi-Cal and your health plan, you may not have any cost, or you may have a share of cost depending on your medical situation. So we really want you to be able to take advantage of this organized, powerful opportunity to have advocacy and support during your pregnancy and postpartum period.
I would say listen to Felicia. She didn't come here to play with you. Felicia, when you said that, I had this vision of us like climbing up a mountain to the peak of the mountain, no matter where you are. There we go, and being there together and supporting the birthing families. Here are some community resources that may help you, and you can scan this QR code to tap into it or go to ladoulahub.com/families. There's essential community resources link there. So that will take you to all types of resources like free diapers and food banks and people who are maybe in housing transition crises, etc. that is a beautiful web link there. So please visit our website. 211. Also, you can call 211 and get a lot of services that you may not think are even out there. You just call and tell them what you need, and they will connect you. There's the National Maternal Mental Health Hotline. You do not have to feel alone. You do not have to struggle or suffer alone. It's available 24/7, 365 days a year. Also, Postpartum Support International Hotline. Many of the doulas here on this call refer families there all the time, and fathers and partners, queer families, people who have given birth and babies are in the NICU, other things that might affect a postpartum person and their family. There's a group for it. You better believe it at Postpartum Support International. There's Mama's Neighborhood, as well as Welcome Baby Program and the WIC program, Black Infant Health Program, the Black Maternal Health Center for Excellence, and the Health Consumer Alliance if you need to learn more about your rights. And Felicia or Chantel, if you want to speak about any of these resources or others, please feel free.
I think that the work that's offered for Black infant health is so powerful because it's about building community during pregnancy. So you're getting education, you have access to resources, and it's a very powerful tool. A lot of my clients have gone through Black infant health, and they really were able to build a rapport with the people that they were in the groups with, but they were able to benefit and feel like they walked away very educated and very supported, preparing them for the labor and delivery and the postpartum period, and caring for a newborn.
We forgot there's a baby that comes at the end of this.
Right.
Lest we forget.
After all of this,
I know, right?
I just wanted to add, Postpartum Support International has been a significant lifeline to so many of my families, and they have support for the birthing person. They have support for fathers. They have free groups almost all day, all night. Families really don't have to go through it alone, and you can get support near you. And these are solid recommendations. And so Postpartum Support International, you don't have to be in a dark and stormy place to reach out to Postpartum Support International. It could just be a regular Tuesday and you're just overwhelmed with breastfeeding and you want to be in a space with other people and you don't want to leave your home. Join a group at Postpartum Support International. Also as a doula, like they're just one of the key recommendations I always share with families.
Thank you. If you want further information on doula services from DHCS, or the Department of Healthcare Services directly, you can go to our webpage and there will be links where you can contact DHCS via an email or click on their various web pages for doula services for Medi-Cal members or frequently asked questions about doula services and how it's defined by Medi-Cal or immigrant eligibility FAQs. So you can scan this code to go there or simply go to our ladoulahub.com/families. There's also a doula directory from DHCS that gives doulas from across the state of California and information on how to contact them. So we're trying to get you a doula, and hopefully this will help you find one that will serve your family in such a unique way. Next slide. Managed care plan member services for pregnant and postpartum Medi-Cal members. Why I think this is important. And also, if you have an individual who is deaf or hard of hearing and use a TTY, dial 711, and that can immediately assist. If you have not been assigned a managed care plan or feel like you don't exactly know where to go, or if you actually have one or who it is, because sometimes you just might not know or might not be clear, please call Medi-Cal Healthcare Options at 1-800-430-4263 and enroll online on the Healthcare Options website. For individuals who are deaf or hard of hearing, please call 1-800-430-7077. You can also scan this code and we'll take you directly to the page that has this information. We want to make sure that there are no limits or barriers to accessing the doula benefit. Next slide. This is just information for the different managed care plans that are in particular in LA County from Anthem, Blue Shield, and HealthNet. If you click on the webpage and go there, you'll be able to scroll down and click directly to Anthem, click directly to Blue Shield, and click directly to HealthNet. And also go to their services page to find out more about the doula services that they offer through their managed care plan. Next slide. Again, there's 6 managed care plans in LA County. So here's the information for Kaiser, LA Care, and Melina. Melina also has the Motherhood Matters program, and they've given you that information directly. And all of this information is also available in Espanol. Next slide. We want to connect with you and stay informed, so please reach out to us at ladoulahub.com/connect or scan this code and join our newsletter, tap into our Instagram channels, and join us at the various events that are available for us to meet you and to find out more about you. Next slide. Ooh, Chantel, do you want to talk a little bit about the Cali Black Doula Directory?
Yes. Okay. Speaking of doula on every block, Frontline is dedicated. And thank you to the LA Doula Hub for support. But if you are looking for a dope doula, look no further. Okay. If you're a doula and you're not registered in this directory, don't waste another minute. Do it right now while you're watching this webinar. The website is right there at the bottom of your screen that you can access. And you will find all sorts of adjectives that describe the different doulas in the directory, whether it is their location, services they offer, specialties, certifications, their social media handles as well. Whether you have Medi-Cal or not, access the Black Doula Directory, the California Black Doula Directory, sponsored by Frontline. We want to ensure that you know that there's a doula on your block.
That's right. Thanks, Chantel. And also for the doulas, want to emphasize, if you are watching this and you're a doula and you are not on the California Black Doula Directory, then what are you doing? This is the place to be. We have over 250 doulas who are part of this network and the directory, and we want you in that number. So go ahead and join today. Go ahead and scan this QR code.
And there's more.
There is more.
Like, I mean, can you believe it?
Don't say we didn't give you a resource now.
That's right.
Listen, we have resources.
We're gonna resource you. We're gonna resource you. We're going to make sure you have the information that you need. So for doulas that are listening here, and if you're looking for more support and want to help navigate how to become a Medi-Cal approved doula through the PAVE system and contract with managed care plans, there are many steps that you have to take in order for that to happen. And so we've created this Medi-Cal Doula Benefit Enrollment Resource Guide. You can go to bit.ly/Medi-Cal Doula Guide, or you can scan this QR code. It is very specific. You have to write in the bit.ly as exactly as you see it on this screen. And when you get that guide, it's several pages long for you to look and start your journey to finding out all the requirements and how to access the different resources that will help you become a Medi-Cal approved doula. So we welcome you along the journey. We can't wait to see you around the various events, and just around the bend. We'll be there smiling and welcoming you into the community. Next slide. Oh, and this. This is actually really important, Chantel. I'm going to let you wax a little bit on this.
Listen, there is an adage that talks about, unless the lion tells their story, the hunter always wins. And so this is the way where your voice gets heard, whether you're a doula or you are a part of a birthing family. We need your voice, okay? And this is the way that we get to elevate your voice and advocate for your needs, whatever your experience, positive or negative. But for sure, if you are having any challenges, any barriers, accessing a doula with your managed care plan, people aren't getting back to you, your provider is not getting back to you with the recommendation that you need to get the additional 9 visits from your provider. If your doula had any challenges, your Medi-Cal doula had any challenges providing support, right? You weren't able to get your doula support in the hospital, at a visit, in the OR. We need your experience. And so families, please share any problems or challenges you're having accessing or receiving doula services that are your right, okay, and that belong to you. And additionally, if you are a doula, we need your voice. We need your story. We need to know how things are going on the ground. And so please scan this QR code, pardon me. We have the toolkit in English and in Spanish. And I want to challenge you, when you download the toolkit for yourself, please share it with at least one of your doula sisters, out there, if not 5. Okay. Please, please share this feedback form. The bit.ly is at the bottom of the screen. We want to hear from you, doulas, any challenges getting paid, reimbursed, your claims being denied, any challenges onboarding with managed care plans, right? So that you can serve members. Anything that's going on, nothing too little or small. Please, it takes 1 to 2 minutes to fill out this form. And again, when you fill it out, I want to encourage you to share this toolkit with a doula friend as well. So this is the Medi-Cal benefit feedback form. Thanks, Deanna. Next slide. Yes, here we have our best practices for hospital doula relations. I just want to let everybody know, if you didn't think we did our work, we've been doing our work for you, okay? So much so that, as a part of the benefit is, we want to ensure that, folks, as many folks as possible have access to doula care, that doulas are compensated, but we didn't stop there. We wanted to ensure that there are best practices in place for hospital doula relations. So when you have doula support, there is an understanding at the hospital that, well, let's look at the 4 principles of doula inclusion. 1, doula care helps mitigate mistreatment of birthing people in the hospital. That continuous support is critical to ensure that every family is represented and advocated for. Here's the second one. Doulas work to support the client and the family, right? We are part of your birth team. We're part of your care team. We should not be, as we see in the next one, we're non-clinicians, don't provide medical care, but we are a part of your care team. We collaborate with your OBGYN, your midwife, your mental health counselor or therapist, your lactation consultant, anybody who's a part of your healthcare team. And number 4, successful partnership necessitates that hospitals commit to the following steps. Here they are: education, training, policies and procedures, and collaboration and accountability. And so these 4 principles of best practices for hospital doula relationships are key. We want to ensure, and you can see the team members that worked on these principles listed. Of course, our one and only Kefri Riley was a part of the team that created these practices so that you don't have your continuous support with your doula interrupted. And these are the core recommendations that we created.
And Chantel, I want to bring Felicia in just for a moment. But I really just want to acknowledge Felicia as well at this time when I'm looking at these lists and the hard work that we've all done. And if you've ever stumbled into labor and delivery room, at 2:47 a.m. in the morning, which all of us here on this call have done, and known that you had to really work just to get through that door because they weren't necessarily going to allow you in, or there was problems down in security, or there was a new policy that wasn't updated to the staff and they hadn't heard because they didn't attend the meeting, or maybe they just didn't know, or there was a lot going on and they didn't understand that doulas in our Medi-Cal doula benefit, and that families who have Medi-Cal have the right to a doula by their side. That is their beneficiary right. And even before the Medi-Cal benefit, even before we even started on this powerful advocacy work that's being done nationwide, doulas are always a part of the birthing experience. We've always been there, and we fought to be there, and we really deserve the right to deliver our services, and the families have the right to doula care. And so I just want to state that this is more than just us loving this work. It's really about the human rights of the families that we serve, and that who are residents of this county and this state, and indeed the United States, and that this is about healthy babies, healthy babies and healthy birthing families. And so it's just really an honor to be able to do this work. And that's why the advocacy piece is so important. And so, Felicia, I just want to honor the work that you've done in community for so long as being one of the founding doulas of Frontline Doulas and the AIM program. And just take a moment to really understand what it means to do this work, because it's really about the mothers, the birthing people, and those infants.
Thank you, Kefri. And you're absolutely right. It is an honorable service to our community as doulas to be able to provide the support that we can. And with all the obstacles that can come up, it's just so powerful to know that you have a team member who's familiar with birth and who understands doula inclusion, understands hospital practices and all those things, so that you feel advocated for, and you'll learn how to self-advocate as a result of the benefit of having a doula.
That part. Next slide. So join the birth equity movement, support local birth justice organizations, visit us at frontlinedoulas.com, connect with us at ladoulahub.com/connect, join our newsletters and listservs. There's so much information and resources that we have on our website for you. You don't have to do this alone. We look forward to meeting you and joining you in this movement. Next slide. This is some of the organizations that are in Southern California, including Beauty for Ashes, Maternal Wellness, Kindred Space LA, the first Black-owned birthing centers in South Central Los Angeles, the Birth Workers of Color Collective, African American Infant and Maternal Mortality Initiative, California Abundant Birth Project, and Sankofa Birth Workers Collective of the Inland Empire. In NorCal, we have Roots of Labor, Black Women Birthing Justice, Children of the Sun, Inc., and Queens Village, Sister Web, Oakland Better Birth Foundation, and Diversity Uplifts, Inc., serving all of California, and Black Mamas Matter Alliance, serving all the United States. So join along and be a part of this powerful birth equity movement by supporting these orgs and donating to them, and finding out how you can also help. Here are benefit resources for you that you're welcome to watch this webinar again and find out more about from our web pages all across our websites, the hospital doula best practices that you learned about today, maternal mental health now connection so that you can get the mental health that you deserve, and all types of information regarding organizations and resources that have supported the implementation of the doula benefit. Also, there is a book recommendation I put here, Listen to Me Good, The Story of an Alabama Midwife, by Margaret Charles Smith and Linda Janet Holmes. It's a beautiful book, and I highly recommend it. Next slide. Not sure if we haven't answered your questions because it was so thorough today, but we welcome your questions via our website Contact Us page, and invite you to join us throughout our social media channels. The revolution is in the womb. Thank you so much for joining us here.
Wow, thank you so much. Thank you, Deanna. Thank you, Kefri. Thank you, Felicia. And thank you, Chantel. This was a lot, and I mean a lot of really useful, amazing information. Each and every one of these women here in this webinar is passionate. We're not only passionate about this work, and like Kefri said, it's about human rights and it's about healthy babies overall. And I wanted to mention, since Kefri talked about Listen to Me Good, the life story of an Alabama midwife, we do have that in our libraries. So please check out lapl.org and you can check the book out. And we have it at several different libraries. So please, it's completely free. Check out the book recommendation. And thank you all so much for joining us again. It was amazing. And to the audience, please, whether you're a birthing person, whether you're somebody who knows a birthing person, please share this information and share this webinar. This is the best thing you can do, is share the webinar, and the person you love, the people you love, will have all this information for them as well. All right, you all have a great day. Thank you so much.